Everybody good? Well, this is a very happy day, and it's certainly good to see our veterans being vaccinated today. We're going to see it in a minute, but I know it started at 10 o'clock this morning. And this is also occurring today in Georgetown, which is the other veterans home as well, and in 8 other nursing facilities around the state of Ohio. So Ohio was granted permission to start this early. We were told initially it was the 21st day that it would start. So we're starting today, and we'll have some more tomorrow, and it will continue to ramp up. We would hope that within 4 weeks we would have all the nursing homes in the state of Ohio done, which means that everyone in the nursing homes who wanted the vaccine and every staff member who wanted the vaccine. So this is certainly a day that I have been waiting for, and I'll feel a lot better once we get through all the nursing homes. Our nursing homes have certainly taken a real hit, and the residents of these nursing homes have really been a great source of the victims of the COVID. So it's a very happy day, and as I said, we've been looking forward to. We have four pharmacy companies that are carrying this out for the state. The pharmacy company that's here at our veterans home that is doing it today is CVS. They're doing a number of the homes around the state. We also have Walgreens, Absolute Pharmacy, and PharmScript. So those are the four that are doing this. Let me introduce Superintendent Terry Prince. Superintendent is doing a great job, and we want him to say a few things about what's already happened today. He can tell you a little bit about some of the first people that were vaccinated. Superintendent, we'll turn it over to you.
Thank you, Governor. I have a few notes. This is the first speech I've given since my military retirement, so bear with me. On behalf of the 550 employees and 375 veterans living at the Ohio Veterans Home, I welcome all of you. Governor DeWine, Fran, thank you so much for being here today. You honor us with your presence. To my right is members of the senior staff. Naomi Twine is our Chief Operating Officer. Andrea Klausing is our Domiciliary Administrator, and Mr. Ross Matlack is our DVS Compliance Officer. I've had the privilege of being here at OVH for the past 2.5 years, having retired from the Navy, and often speak to our staff about being deployed. And right now, the building behind me and to your right, the veterans and staff members have been deployed at this facility and in Georgetown for well over 10 months now. But Governor, you can be justifiably proud of each and every one of the staff members and veterans who's borne the fight against the unseen enemy of COVID-19 and given of themselves not only to protect, but to honor the service of Ohio's heroes, our veterans. Since the beginning, we received outstanding support from the Governor, the Veterans Administration, the Ohio Department of Health, and local partners, including our incredible teams at the Erie County Health Department and the Firelands Regional Medical Center here in Sandusky, the Brown County Health Department, and the Mercy Claremont team in Southern Ohio. Right in front of me, in which the Governor has had a chance to view and will look at, is what's going on in the building behind me. And that is the vaccination clinic. 2 teams made up of brave and caring OVH and CVS employees are working together to administer the first round of COVID-19 vaccination to our veterans and staff. They're working together to bring a sense of normalcy and, more importantly, a glimmer of hope to our residents and families. This morning at approximately 10 a.m., 2 veterans in the domiciliary, a United States Army Special Forces captain and a corporal of the United States Marine Corps, were the first 2 veterans in the Ohio Veterans Home to receive the COVID-19 vaccination. And just over an hour ago, in the building behind me, the nursing home, a United States Army corporal and veteran of the Korean War marched down to the vaccination clinic and reported for duty as the first veteran of the nursing home to receive his vaccination. The same courage it took for them to raise their hands and swear an oath to defend the Constitution of the United States of America was on full display again today when they rolled up their sleeves and once again went into battle to protect their battle buddies, their shipmates, and their wingmen against COVID-19. Finally, this is a truly historic day for the Ohio Veterans Home, and we are so thankful to have been designated as a top priority by Governor DeWine. We are forever grateful for your service and the Ohio Department of Health for ensuring that the Ohio Veterans Home was one of the first homes in the state to receive the vaccine. Governor DeWine, thank you for the opportunity to lead this amazing team, and as a veteran, thank you for your unending dedication to Ohio's veterans and their families. We are truly in your debt. Thank you. Up.
Superintendent Prince, thank you very, very much. Well, can you see it in there, Fran? I got you up too. Let you all see that. Why don't you hold up so I can at least see what we're looking at. Yeah. I can see it right there. Oh, how y'all doing in there? Are you are you ready for this?
Thank you.
Are you ready?
All right.
We good?
We're good. We're good.
Just gonna swab you down real quick. Make sure you're nice and sanitized. Just relax this arm the best that you can for me, okay?
I don't know what you're saying, but okay.
Put a Band-Aid on you real quick. How did I do? Did you feel it? You're all done. Good?
Thank you very much. Thanks for your service as well.
98, July 26th.
Say it's 98.
Feels like 26.
Born in Cleveland.
Born in Cleveland. Okay.
My folks came from England in the 20s. My sister and I were born here in St. Louis.
I cannot talk to you right now.
July 26, 1923. And they went back to England in 1933
Okay.
because of the Depression.
Okay.
Oh wow.
I
Oh wow.
was 10 years old. And I went to England and went to school there. And I finally got, later on I got a job working on Spitfires.
Oh wow.
Building up-built Spitfires.
That's awesome.
Fighter plane. That was a good plane. I won the battle over London in the war was on there. I went through the whole thing, and I joined the service when I was 19, and I joined the service because I trained in Wales.
Okay.
Trained in Wales, and I got assigned to General Scott in London, just outside of London. He was the head of the Air Force
Okay.
at that time, and the war ended over there, and I was in the hospital for a while. I came back here. I was going to Japan.
Wow.
I was in the infantry then.
Right.
During the Battle of Britain.
Oh, wow.
Poles,
Yep.
they needed more men, and I was one of them that they picked. And I went back to England for training. And I got injured and I had to be in the hospital for a while. And then I came back to the States and they gave me an option to go to Germany for occupation or go back to the States.
Okay.
I decided to go back to the States.
No,
I didn't have anybody here.
that's a good choice.
It took me 16 years to get on my feet. And but the Truman dropped the bomb on Hiroshima and Nagasaki. And the time I came back, they didn't need us because Japan was over there.
Yep.
And I decided you got 30 points, you get out of the service. So I did that. Went out.
Well, thanks so much for your service. We appreciate it. I'm gonna wave to you. Thank you.
Thanks for your service, Mr. Highland.
Well, it's been a long time.
You look great.
So how you guys doing in there?
How's it going in here today?
How's it going?
We're vaccinating a lot of people. We're excited. It's like ground zero here today.
Well, that's great. Yeah, we'll take a look a little bit back there. Yeah.
Yeah.
So you started this morning, and so it's going.
Yep. We got here at 8:30 this morning to prep, and then we started vaccinating at 10 o'clock, and we've been doing it since then. So trying to get as many people protected as we can while we're here.
No, that's great. That's great. Well, thank you very much. Thanks for everything you guys are doing. We appreciate it.
Thanks, Governor.
Thank you.
Depends on the way things are going.
So we'll be happy to take any questions for me or for the superintendent.
Governor, how did you get it working where if you're expecting the vaccine a little bit later, how did you get it that Ohio could get it earlier like that?
You know, the vaccine came in when it was supposed to come in, but they had a date of the 21st that they said, we think it's going to take you that long to get the consents and do those things and get ready. And we told them we didn't think it was going to take that long. And so they allowed us to go ahead and start that today. And so we've got 10 different nursing homes where this is occurring. And you know, we'll have more tomorrow. And it will, as the days go on, it will certainly ramp up. And we think within 4 weeks that we should be able to hit all the nursing homes. Now that will obviously not take all the congregate care settings. We've got assisted living, we've got other places, but we think 3 to 4 weeks in regard to the nursing homes. So it's something we've really been waiting for. The nursing home residents, I'm sure, have been anxious about this, and I think that anybody who has a loved one in a nursing home, you know, is starting to breathe the sigh of relief because they know that the vaccines are coming. I mean, we're going to get them out just as quickly as we can to every nursing home in the state. This is where we've seen the most casualties, where we've seen the most people die, and this is protection that we have to get them in just as fast as we can. So we're very excited about it.
Can you explain why this was 1 in 10 to receive the first vaccine?
You know, I have visited both of our veterans homes. We have one in Georgetown, the other end of the state, and we have one, of course, the one here. And have had the opportunity to talk to many of the veterans. But it just, you know, we want to do all our nursing homes. We would love to do every single nursing home today and have them all done. But it just seemed to be the right thing to do, that in those first 10, that our 2 veterans homes be included today. Everybody's worthy. We want to cover everybody, but it seemed the right thing to do.
Governor, have you noticed since the vaccine started to roll out, is there competition between the states? Has there been any back and forth about who gets what and when?
No, you know, these are really assigned, and, you know, we work with the federal government, but I don't look at it as competition between the states or among the states. There's a formula. It's based mostly on population. There's a couple other factors, I think, in there. And, you know, we really don't know what we're going to get for sure until we get it. You know, the numbers continue to kind of change as they try to adjust them. We thought the last figures I saw this morning looked like in the month of December we should get about 530,000 doses, but I think that, you know, that will change. And we also with the Pfizer, we're finding that in some cases in the vial you can get, instead of 5, you can get 6, and sometimes you can get 7 out of them. So our team asked me about that. I said, no, we keep rolling. You know, the instruction to people who are doing the shots is, if you can get 6 out, if you can get 7, you know, that makes it go farther, and that's great. We can get more people done quicker.
Governor, where are you traveling today?
We started at home in Cedarville, Southwest Ohio, and we went to Columbus for a nursing home there. Then from there we went to Parma. So we just left Parma, and from here we go back to Columbus and then back to Cedarville. So we're going to be at three of our nursing homes.
In our region here, the 2 big Toledo hospitals got it, and it's coming here. What sort of steps are you making sure that rural areas start to get it sooner rather than later?
Yeah, and the first 10 hospitals were picked, you know, last week as far as the shipment, because they wanted us, the federal government wanted us to make sure that they had the capacity there in regard to the deep freeze, because it's Pfizer. When Moderna comes out, and we think that will start arriving on Monday, the Moderna will go out. 70% of what comes in from Moderna will go directly to hospitals all over the state of Ohio. So this is a whole large number of hospitals will get that shipped directly. At the same time, about 30% we're allocating initially for our local health departments. Local health departments, for example, are going to handle the EMS. We have EMS first responders who are really exposed every single day. When they go into someone's home, they have no idea if they have COVID or they don't have COVID, because the COVID is so widespread today throughout the state of Ohio. So covering the EMS is very important. Our local health departments will be doing that. Our local health departments also will be covering some of the smaller congregate care settings, some of the group homes and things like that, where we think that the risk is high, and they will be the ones that will be doing that. So our local health departments have done a phenomenal job, 113 of them in the state. They not only are doing the tracing and all the other work that they normally do, but now they're involved in getting the vaccine into people's arms. So a lot of things going on. But you know, Moderna coming in at a large amount, and that's a good thing. So we think, as I said, you know, at least we'll have about 500,000 doses in the month of December, and we'll keep everyone informed as far as what is actually coming in when we get it. The other thing you might want to look at is tomorrow we will put our dashboard up, and in that dashboard we'll start reporting how many people have been vaccinated. And then there will be also another place on there where you'll see that when we get to the second shot for people, it will show how many people have gotten the second shot. You'll be able to go down and look at the county, break it down by your county. You'll also be able to break it down by race and other things. So people will be able to see exactly who is getting the shots. And it's very helpful to us as well, so we can keep track of this. So the dashboard will be about a day behind, so you have to report it in. So 4 pharmaceutical partners, CVS is the one that is here, and they will be, you know, reporting back into us, you know, how they're doing and how many shots that they're giving every single day.
When are the EMS workers expected to start receiving?
Yeah, this will be going, Moderna vaccine will be going to the health departments beginning Monday. And the health departments will be in charge of the EMS.
When can the other first responders like police and fire, you know, the rest
Yeah.
aren't paramedics and EMS?
Yeah, the first group, and what we're doing in Ohio is very consistent with what the federal government came out with and what their recommendations were. And it's really 2 big groups. One is people who live in congregate care settings, which we know are the most at risk. About 350,000 total. All those are not in the nursing homes, but if you look at the total number of people who work in congregate care settings and those people who reside there, it's about roughly 350,000. Then you have your healthcare workers, which includes EMS, and that is a much bigger number. And so what we've asked the hospitals to do when they get it, and they have a real interest in doing the same thing, and that is protecting their most vulnerable. And their most vulnerable people we're looking at, of course, are people who come in contact with people who have COVID or might have COVID. So that's the first 1A group. We have not designated the second group. So the first group, I think there's a pretty broad consensus. When you get to the second group, there's a lot of ways that you could look at this. Our criteria, frankly, is going to be pretty simple, and that is saving lives and slowing down this virus. So, anybody else?
Governor, if we're getting more and more vaccine, what are you looking at as your threshold for maybe getting rid of the curfew or scaling back on discussion of masks?
Sure.
Where do you feel there?
Sure. When we look at this, I mean, what we have today is great spread throughout Ohio. If you look at every county, the lowest county as far as spread has 3.5 times what the CDC says is a high incidence level. So 3.5 times high incidence level. The county with the most has about 13 times. So every county has great spread. So what we have to do, if we're going to have kids in school, if we're going to not see our hospitals overwhelmed, and if we're going to protect our people in our nursing homes, because we're not going to get all these shots out immediately. So we have to still protect our people in our nursing homes. The way we do all three of those things is to keep the spread down. So we've got to tamp this fire down. It is much, much too hot. So we can't even begin to look at things like that until we take this down. This is the highest level it's been. It's not been this high at any time during this entire 9-month pandemic. So there's great danger out there. And what we're seeing with our schools, we would love to have all the kids in school in class. But we have over 50% of the kids now who are not. And relatively small number of kids now who are in class 5 days a week. We have some who are in a hybrid situation. We have some who are totally remote. What's driven that is the fact that schools are, because of the widespread COVID, schools are not able to put, in some cases, bus drivers in buses. They're not able to put teachers in, and the other thing they're not able to do, is they got too many kids quarantined. So that is a direct threat to keeping kids in school. So we can't begin to think about pulling back on anything until we can make sure we get this virus down low enough, we can get kids in school, and we can do the other things that we really need to be doing.
Now that shots are in arms, do you think the next step would only be to pull back instead of heightening more restrictions?
Look, the next few weeks, I mean, this is a very high risk time because this is a time when we all get together for Christmas and New Year's, and people congregate a lot, and that is great. But my wish for every Ohioan is that we get through this so that next Christmas we'll all be together. Fran and I will not celebrate Christmas this year the way we usually do. All our kids usually come home, and all our grandkids are there, and we have a great time. We will simply not be doing that this year. We will be pulling back. We'll be cooking some food. Fran will cook. I'm not the cook. I shouldn't say we. Fran will cook, and anyway, we'll deliver food to our kids who are close, and we'll have some kids probably stop over and pick up food. But it's not going to be Christmas. It's not going to be Christmas the way the DeWines usually do it, and we just have to pull back, and we have to look at this from the long run. We're losing too many people, and really, my request for everybody is just be safe. What we're finding is the spread is really coming from people just getting together and letting their guard down, being together with family, being together with friends. And what the doctors tell us is pretty simple. If you don't live with someone, don't eat with them. If you don't live with someone, don't drink with them, because you can't wear a mask when you're eating or you're drinking. And anybody who does not live in your family, if you are with them, you need to keep some distance and you need to wear a mask, because you don't know if they have it, they don't know if you have it. And the problem with this virus is so many people have it, and they don't have the symptoms, but they can certainly spread it. So we're in a real battle, and this is a very very important time in the next few weeks. And what we do in the next few weeks is going to determine, can we get more kids in school? Can we get them back in school? And we have some schools in this state, the kids have not been in school all year. I mean, they've done it totally remote. And some kids thrive with that, but we have a lot of kids who don't. And some kids who really, there's been reports out of some of our major cities where, they've had kids who just aren't logging in at all. And that's not good. That's not good.
Looking back this week, have any issues or concerns popped up as far as distribution of the vaccine?
We've not had any distribution problems so far. This is a lot of moving parts, as you can see, and we've got a lot of people involved. We got the four pharmacy companies involved as far as getting our nursing homes. We've got our local health departments, and of course we've got the hospitals. So a lot of things going on. So far, so good. We haven't seen any major problems yet at all. But that many things going on, there's going to be some glitches. There are going to be some things that don't work. But our goal, as we work with everybody, is just to make sure that when we get that vaccine in, we get it in people's arms just as quick as we can. No major side effects. I mean, I think people were watching this, and I think what's going on is that people are trying to learn more. I get the question, well, what percentage of the people you think will actually agree to take that shot? And we don't know that, but I think it's a learning curve. I think we're all watching, and I think though when people see first responders, doctors, nurses, EMS getting shots, I think that's going to give them more confidence. I also think as they just watch TV, listen, read newspapers, and just read up more about the process, they'll have more confidence as we move forward. I mean, it literally is a matter of life and death. I mean, making sure that people, can have the availability, and we're not forcing anybody to get the shots, but we want them to have that availability, and we certainly would encourage them to get the shots. It is a matter of, this is how we protect people in our nursing homes, for example. This is how we protect our first responders. This is how we protect the EMS. Anybody else?
Thank you.
Have a good day, everybody. Thank you. Use this.